There's a 3-year research effort going on at the Baptist Cancer Center studying the effectiveness of caring for lung cancer patients using a multidisciplinary approach. That's when the key medical specialists involved in a patient's care coordinate their efforts in one place at the same time. Doug Johnson has an update on the study working to keep patients well beyond a diagnosis.
More than 200,000 Americans will be diagnosed with lung cancer this year. The process of figuring out what to do about those diagnoses can be time-consuming, requiring that patients take a number of steps, including not only determining what the problem is, but then trying to determine what's next.
With lung cancer, there are many different possible what next. It could be to repeat the biopsy if you don't get the answer. It could be to go to surgery. It could be to go to chemotherapy. It could be to go to radiation therapy. It could be to go to hospice care. Now, each one of these things requires a completely different type of doctor.
An earlier edition of Smart Medicine detailed how the Baptist Cancer Center received a $2.1 million award to look at a new way to treat lung cancer. PCORI, the Patient-Centered Outcomes Research Institute study, looks at standard care, which can require patients to see specialists at different times and places. And then it also looks at multidisciplinary care, which brings specialists together at the same time and in the same location to see patients and then compare notes on diagnosis and treatment.
All the key specialist doctors, the thoracic surgeons, the pulmonologists, the medical oncologists, the radiologists, the radiation oncologists, the various key experts who provide components of care for lung cancer patients actually come together at the front end.
The PCORI study will last 3 years and compare 2 forms of patient care to see if adopting the multidisciplinary approach leads to improved patient care and outcomes.
So what we decided to do was we would do a head-to-head comparison of the patient's experience and the results of care delivered within and outside the multidisciplinary care environment.
The first part of the study included a series of focus groups. Researchers wanted to know what various participants thought, so they questioned doctors, nurses, and other healthcare providers, administrators of hospitals where the care is given, and insurance company executives who pay for care. They also wanted to know what patients thought.
And we learned a lot. We learned that patients love the concept. For them, it's a no-brainer. It is much more convenient. All your doctors are right there. We don't have to hop, skip, and jump from one clinic to another, to another, to another.
They're about 6 months into the study. They're currently recruiting 2 groups of patients. They want 150 patients receiving care in the multidisciplinary program who will get care in a new clinic on the Baptist Hospital Memphis campus. For comparison, they want to find twice the number of patients receiving standard cancer care for similar problems. The recruitment process should take another 1.5 years. Then they'll begin comparing the treatment outcomes. For Smart Medicine, I'm Doug Johnson.